Welcome to Sioux Falls, South Dakota. It's a beautiful day down over here in southeastern South Dakota, wherever you're at. But we hope that spring work is going well. We know a lot of people are out in the field planting, getting all kinds of stuff done. I'm hoping to do my garden this weekend myself. We're here today to talk to you about preventing and treating some aches and pains that we know farmers get. We know you guys have them out there. So even if you are not a farmer, we hope some of the information that we give you is helpful. And if you know someone who's in farming or a farmer, please feel free to pass this on to them. Hopefully it'll be good information for them. During our time with you, if you do have any questions, just put them in the comments box below, and we'll get to them at the end of our live presentation here. But we'll start by introducing ourselves. My name is Michelle Schuman. I'm a physical therapist here with Prairie Rehab in the southeastern South Dakota, southwest Minnesota area. We have lots of clinics throughout that area. I actually grew up on a farm in northeast Iowa, married a guy who's in agriculture, and have worked with crop farming and raising hogs pretty much all my life.
I'm Gidget McAreavey, and while I'm originally from the city, I'm a city kid. I am married to a farmer and have been for 22 years. We have a cow-calf operation, and we raise crops and live north of Sioux Falls. I've been with Prairie Rehab as an occupational therapist for 22 years. 20 years, so I've been married for 22 years. Been with Prairie Rehab for 20 years. So yeah.
So we have a lot of farming experience behind us, as well as our therapy experience. So we don't want to take up a lot of your time because we know it's a busy time of the year, but we do want to discuss these aches and pains because we know they can be limiting to you as farmers, and let you know that there's things that you can do about it. We want you to remember that your most valuable piece of equipment is you, your body, so you need to protect it and take care of it. Being raised on a farm, living on a farm most of my life, Gidget being married to a farmer, being on the farm, her adult life, we know what it's like. You guys work from sun up to sundown. You work a lot by yourself, so you do things that are heavy lifting, heavy moving, probably things that should be done by two people, but you just go ahead and do it yourself. There's always work to be done. Even in the middle of winter, especially if you're a livestock guy, that's year round, every day, all day long. So we know that you guys just do it. So Gidget said the other night when we were kind of going through things, she said, whether it's spraying or haying, they're getting her done. And that's the truth. You guys are always busy getting stuff done. With the more recent changes that we've had with the COVID-19 virus, you might be familiar with telehealth or telemedicine. Maybe you've had a visit with your doctor through telemedicine, or you know someone who has. And that's something that we as therapists can do with you as well. So that's a great opportunity. I know you farmers have a hard time getting away from the farm. So, but you could give us a call and we can, whether it's FaceTime or by video or by telephone, most insurance companies are now paying for telemedicine visits. And we can help you figure out, the source of your pain and maybe some exercises, stretches, or ways that you can alleviate your pain and keep working. We know that those aches and pains can be really limiting.
Yeah. So according to the National Institute for Occupational Safety and Health, along with the CDC, agriculture is ranked as one of the most hazardous industries, which there's so many moving parts to farming, it doesn't surprise me, I guess.
Right.
So over 100 ag workers have suffered lost work due to injury daily. In 2018, over 2 million full-time workers were employed in agriculture in the United States, and an additional 1.4 to 2 million hired crop workers. In 2010, 50% of all hired crop worker injuries that were reported were sprains or strains. And when you think about sprains or strains, you think about lifting something that was too heavy or twisting or pulling or doing something you shouldn't be doing. So sprains and strains are common and result from injuries a lot of times from overuse or improper use, I guess is also a way to say that. They can occur in any part of the joint, any joint of the body. So we're going to go through systematically, I guess, from head to toe and go through a few things that you might see. So I'm going to start with the upper body. So the shoulder is one of the most common injuries or painful things that we see for overuse, overuse with the shoulder. So diagnosis can include a rotator cuff tear, tendonitis or bursitis, impingement. There's a lot of different diagnoses that you might see, but at the end of the day, you're going to come to us and say, my shoulder hurts. Why? What can we do to fix it? People might say they have a pain out on the outside of the arm. It's kind of nagging, aching, painful at night, trouble sleeping, clicking and popping, things like that. So I can think of 5 farmers just off the top of my head in the last year that I've worked with that have come in with various shoulder pain, whether it's from a rotator cuff tear or some other injury. I know you farmers will recognize some of the things that I have had people tell me that they've done. When you're coming down off the combine or the tractor, you're going forward. When I come down, I go backwards, but a lot of you guys are just quick. You go down forwards and you have an arm that you slip and your arm stays back, and now you've got shoulder pain. Throwing too many bales, because that's not really nobody should have to do that, I don't think. Make the young kids do that. But throwing too many bales, carrying buckets, 5-pound or 5-gallon buckets of feed, different things like that, things that we have done all the time, but sometimes as we age, it's harder on our bodies, or we just are doing too much of it in general, and our body mechanics aren't good.
I had a recent patient that he was actually preg checking a cow, and while he had his arm in the position for preg checking, the cow bucked up, and he ended up with a rotator cuff tear, and ended up having that surgery.
Yeah. So, and not all injuries would require surgery, but some do. But if you have pain in your shoulder and you come in, we can evaluate you and determine, there might be something that we can do to help your pain. If the doctors have determined you don't need surgery, there's a lot of things that we can do in physical and occupational therapy to help your shoulder pain and improve your movement to get your strength back. So some common stretches now these stretches aren't for just everybody and not for everything, but some real common stretches that I give people with shoulder injuries and shoulder pain, once their pain's a little bit more under control. So a broom handle or a stick. Every farmer in your shop or somewhere around has something that you can use, and just to stretch, we want to make sure you're stretching, keeping that motion going, whether it's straight up over your head, it's out to the side, either direction, just making sure you're not losing the motion. When we have pain, if we stop using it, if you stop moving that arm and I guess I'll say baby it too much, that can cause further issues. So we want to keep you moving and keep you mobile. Some of the other shoulder stretches that I have people do are going into a doorway, doing a pec stretch, opening yourself up, whether it's coming down this way into a door frame or up above. That's a good one. Those are kind of some of the main ones, coming in doing a stretch this way, stretching the back of that shoulder either direction, making sure we're getting everything stretched out. Moving down to the elbow from the shoulder, again, overuse is probably one of the most common reasons for elbow pain. Again, we can have sprains, strains, tendonitis. You hear people talk about tennis elbow or golfer's elbow. Tennis elbow is on the outside, golfer's elbow is on the inside. Lots of different injuries and painful things that can happen with the elbow. Recently I had a farmer that I know fairly well because I'm married to him have some elbow pain, and he fights with it off and on and has for a number of years. But most recently the thing that really bothered him was that constant static elbow bent position. So too much time in the tractor, behind the wheel, not getting that elbow straightened out. We know that's unavoidable certain times of the year, especially right now. I mean, we're planting, the weather's good, unlike last year, so people are, those farmers, you guys are in the field, you're going, trying to get things sprayed, trying to get things in the ground. But making sure that you stretch, getting it straightened out because you're bent for so long, so you can do stretches to straighten it out, both directions. And again, with stretches, if anybody has any questions on stretches, we can give you handouts, or we can discuss stretches with you, and we can talk a little bit more about how to get in touch with us at the end of our presentation. Then we can go down from the elbow to the hand. The hand, again, painful. Not as much overuse with the hand as a lot of times for the most common reason we see hand pain is probably arthritis. And while not everybody has arthritis, a lot of folks do fight with it, whether they know it or not. And so when you think about the hand and hand pain, constant gripping is probably one of the most common things that I see when we're trying to figure out why people are having so much pain. It's a lot of constant grip. Again, steering wheel, buckets, things that you're lifting, those kinds of things. So making sure that we're stretching those fingers. If you start having numbness, that can be a whole other issue. It can come from a lot of places, but if you have numbness in the hand when you're in a static position like this or gripping, it could be a carpal tunnel type thing coming on. Gripping is one thing that will really aggravate carpal tunnel. So that's something that is something that we can help you with too. And I do see that in farmers a lot. It seems like a lot of people, we start here and then they're like, well, yeah, I have this numbness in my hand too. And we kind of go through it and figure out what's going on. But sometimes it is a carpal tunnel, sometimes it's from something up higher, but we can go through that with you.
Like you mentioned with the arthritis, it doesn't only affect the hand, it really, in most people, but also in farmers, it can affect any joint in your body, So arthritis is inflammation of a joint, and oftentimes it's brought on by wear and tear of the joints. So specific arthritis that's due to wear and tear of a joint is osteoarthritis. So if your doctor has talked to you about osteoarthritis, that's what it is. It's basically you're wearing your joint out and getting some cartilage tears and stuff in there, and eventually it gets to the bone on bone that might result in needing some intervention. According to the USDA Agri-Ability Study, 1/3 of all farmers and ranchers do have limitation due to arthritis pain. And arthritis can not only create pain, but also limited range of motion, which means you can't move as well as you used to. Happens to all of us. But farmers often also don't allow themselves enough recovery. So not just recovery from an injury, but recovery in general. So just like you were saying, your husband, the other day went 36 or 38 hours straight without sleep because he was trying to get that corn in before the rain came earlier this week. He got it done, but he's exhausted. And when farmers are fatigued, there's just more of incidents of injury when that fatigue comes on and you've been in the tractor for hours and hours on end and trying to get things done. So let's take a look a little closer at some injuries and pain that comes on in the spine and in the lower body. First of all, the neck. Some studies that I read showed that over 75% of farmers do suffer with neck pain and headache pain. So that's quite a bit. Most frequently associated with this is the whole body vibration. Whole body vibration and having your head in a rotated position. So what does that sound like? Driving a tractor. So again, that old tractor is going to get you every time. So ways to prevent and decrease this is to change positions often. Adjust your seat in your tractor. Nowadays they do a lot of things with air ride seats, hydraulic seats. They have a lot of adjustment, but it's just it's part of the job. You got to look back and make sure your equipment's okay, look forward and see where you're going. Even with the new technology of the automatic, auto drive, you're still like in this half-turn position and you're looking forward, you're looking back, or you're face forward and you're still looking back because you're constantly checking to make sure everything's okay. So that rotation and that vibration can really aggravate the spine and the neck. Other things to alleviate this pain is taking breaks, okay? Work for a period of time and then take a break. Even if it's just short, just stop the tractor, get out, walk around and check your equipment. Take a few minutes, get back in, and get going again. You might feel better. And then, just like with the upper extremity stuff, stretches. Stretching is important. With the neck, it's pretty easy. As your tractor is automatically driving itself down the field, you can do some stretches, just down and up, side to side, just kind of go through that full range of motion. You know, when you're talking about the elbow, if it's bent, you want to straighten it out. Well, if you're sitting like this for a long time, then you want to stretch the opposite direction. Take yourself out of that. Another exercise that's a good stretch is a chin tuck. So a chin tuck is just bringing your chin straight back, so you're really straightening that neck and pushing the back of your head back. It really gives a good stretch to those muscles in the upper neck. And then lastly, one that I think of is kind of a rotate and nod. So to turn your head as far as you can to one side and then look down on the ground as far as you can. That gives you a good stretch of those muscles on the side, and then the other way and looking down, good stretch on the side. So those are just a few stretches. Moving down into your back, the rest of your spine, back injuries, very prevalent. Back pain, just having that ache and pain of having back pain. It can involve muscles, ligaments, tendons, your disc. So your discs in your back are like little water pillows that are between each of your bones in your spine, your vertebrae. And they allow for movement and cushion, and sometimes they can become damaged. So the discs also help prevent nerves from being pinched. So therefore, that leads to some of the diagnoses you might have with back pain: sprains, strains, disc injuries, nerve pinch, any of those things. And then, of course, the arthritic changes that we have from wear and tear on our back can cause pain and limited motion. These things often develop gradually. You know, there might be an instance where you go to pick up something heavy and, I felt something pop, or I heard something in my back and boom, that pain came on. Yes, that can happen, but a lot of times this is a gradual onset from repetitive work, and you've been working hard and doing good and just working busy for several weeks, and then your body finally says that's enough, and it's had enough, and you start having pain. So a lot of times it is on that repetitive activity. Farming activities that can bring on back pain, again, tractor driving due to the vibration and the awkward postures, heavy lifting, awkward posture when you're lifting, or I often think of when farmers are doing mechanical work on their equipment, to reach that one bolt, and they're halfway laying across the equipment and reaching and cranking on something. It puts you in some really odd postures, or you're cranking as hard as you can to get that one that's rusted down loose. Some of those things can you strain, you overwork to get it done, and you end up with a strain or a sprain. Other things, pushing and pulling, of course, bending and twisting. This time of year, the seed bags, things like that. Sometimes to dump that seed bag into that seed box, you're reaching and you're twisting all at once. So it can take its toll on your back. If you don't pay attention to your back pain or your back injury, it can have serious long-term and sometimes permanent consequences. So you really want to protect your back. You want to protect those joints. You want to take care of it. And one of the main things is when you start to have pain, do something about it. Call your doctor, call a therapist, give us a call, at least talk to us on the phone, see if there's something that we can do for you and get you feeling better. Some of the things you can do treatment-wise at home are using a heating pad. If it's a sudden onset of pain, you're probably going to use cold pack. Get that inflammation down, maybe some over-the-counter medicines, some Tylenol for pain, or anti-inflammatories like ibuprofen, Advil, Aleve, things like that. Those are things you can do at home to help alleviate some of the pain and inflammation. And then you're going to want to find out what exercises are best for you. There's so many back exercises, and it really depends on what kind of injury you're dealing with or what is causing your pain. So I'm not really going to go through any of them today, but again, if you have any questions, like Gidget said, we can always send out, after talking with you, send out some exercise forms to you and stuff. The other joints, you get into your legs, your hips, and your knees. They take a lot of abuse. She was talking about the shoulder injury that can come on from jumping out of the tractor or the combine. There's a lot of hips and knees that I see that wear out from jumping out of the tractor and the combine. A lot of times we're right-handed, right-legged. I can almost guarantee if you pay attention to how you jump out of your machinery, you land on the same leg every time. So that makes it hard on those joints, but it also can kind of throw off the alignment of your pelvis and your low back and make issues all the way up into your back. So jumping out of your equipment, not a good thing. So slow down just a shade and just climb down. Use that last step. Nobody's last step, it never gets worn out because they jump right over it. So, so another thing that aggravates these joints is climbing. So if you think about climbing in and out of the tractor, the combine, climbing bins, climbing ladders, whether you're working on a barn or a shed or working on your equipment, there's just a lot of climbing that goes on. And then you get into the heavy lifting as well that can take its toll on your hips and knees. And then lastly, if you already have a joint that's aggravated, hip or knee, and then you're always walking on uneven ground, think about it. You're on gravel, you're in the cattle lot, you're in the hog lot, you're out in the field on those clumps of dirt. It's always uneven ground, and that can place a lot of strain, especially on a joint that's already painful for you. Taking care of those hips and knees at home, again, hot pack, cold pack, anti-inflammatories, your Tylenol to minimize your pain, rest, taking a break. If it hurts, you don't want to just keep pushing it. With your knee also, you might end up using like a wrap or a brace that you can, some of those are pretty inexpensive and you can purchase at a pharmacy or Shields or anything like that. So, and again, depending on your injury is what's going to determine the appropriate exercises for you.
Yeah. And, as we talk through kind of the body parts, you can see a lot of things overlap. Mm-hmm. So, when we talk about injury, we can have a primary injury and a secondary injury. So primary injury might be from, like I talked about earlier, when you jump down out of the combine or tractor and you miss the last step, you slip. If it's just an accident, you slid and your arm jerks back. Okay, so now you have a sore shoulder. Well, now I'm fighting with this, and I'm going to take a little liberty here because I'm married to a farmer, and I'm going to generalize. Farmers are kind of sometimes stubborn. My farmer is stubborn, and so it'll get better. We're busy. We don't have time to deal with it right now. Okay, so now my shoulder hurts, and it's hurt for 2 weeks now. But I'm busy. I don't have time to take care of myself. So now, because I've been lifting differently and doing things differently, now my back hurts. So the shoulder is your primary injury. Your back is your secondary injury, and that can go for a multitude of things. You might do something to your knee, and now because you're doing funky things with your knee, your back hurts, or it kind of goes both ways. So
yeah, the result is you end up with 2 injuries instead of just one if you don't pay attention to it. So just to review real quick, body mechanics is very important, with all of those things that we were talking about, climbing, lifting, bending. But one of the other things is, we mentioned the technology of the automatic tractors, but technology-wise, farmers are on computers more, they're on their phone more, they're on tablets more, and you have an office, but how much are you really in that office? Your office is your pickup truck, it's your tractor, it's, maybe your laptop is on the hood of your truck while you're doing, or on your tailgate, So you have to think about your body mechanics and your posture, even when you're on the phone, when you're working at your computer, etc. A week from today at 1 o'clock, one of our other occupational therapists, Tim Meyer, is going to talk about work site ergonomics and desk ergonomics and stuff. So some of that will be a good takeaway to, okay, how am I sitting when I'm working on my tablet, when I'm working on my laptop, etc. So that might be a good one to tune into as well. But good posture and body mechanics can take a lot of strain off of your joints and your spine as well. So somebody might ask, so what can a physical therapist or occupational therapist do for a farmer who is having pain? Well, the telemedicine visits is a great way to start, but as a therapist, we are trained to look at what might be your source of pain and how is it affecting your function? How is it limiting you from doing your job? We can help identify treatment methods and what works in your schedule to help you feel better. And we're able to guide an individual through a recovery process, whether it's from one injury or a gradual onset of pain or post-surgical.
So when would it be appropriate for you to reach out and decide that therapy is what is necessary? In our opinion, I guess if you're having pain that's limiting your daily function, if you have decreased strength that's limiting your daily function, you can't do the things that you used to be doing, PT and OT can help try to improve those things so you're back to your prior level of function. Depending on your insurance, you might need a doctor's order. Not all insurances do, but you can contact one of our clinics. We can do a 15-minute free consult to talk through things to determine, is this something that we should reach out and get a doctor's order for if we need it because of your insurance, or have you come in and do a full evaluation, or we could do a telehealth evaluation too, depending on kind of what's going on, but that might be beneficial. So yeah.
You can just call any of our offices, look us up online. We have a website, www.prairierehab.com, that lists all of our locations. Reach out to us on Facebook, by email. We're out there. So give us a call. Good luck and have a safe spring.